Yes. All right, folks, we're here with Tony King on Medicare Moments here on Pod TV. We're having a very exciting show. We've got a lot of activists here on the network. I know that we've got a person that does a show around timeshares and all the problems that they've got. So that is Irene Parker with Surrender or Solutions or Surrender. That's right. That's the title of the show and all along those lines. But right now I've got Tony King and she's been finding all kinds of things going on with the Medicare situation and a lot of things that we should know that we don't know. And she keeps reminding me, and I don't need to be reminded because, we like to think that we are going to be youngsters forever, but I am going to hit the big 6'5" next year and everything like that. So, Tony, I know I got to deal with these things and all along those lines. I think that Kim's got to deal with it even sooner because I think her birthday is coming up. I want to say it's in October, but don't quote me on that and everything like that. But I know it's coming up this year, so she'll hit the 6'5" this year. I'll hit the 6'5" next year because on a week from today, I'll be turning 64 and everything like that. But I do know that these are things that I'm going to need to deal with and that people are always talking about. But you've got some things that you wanted to bring up on this particular episode of Medicare Moments. I will turn it over to you and definitely hear what you've got to say about a number of these things. But I'm glad to be here with you as always, and all along those lines. I might get off camera so that I'm not being a distraction, and all along those lines. But I will probably come back on camera later and everything like that. But definitely share with us what you've got on your mind, and I may
You
have some.
can split it when we're both looking at each other. There, right now, there's one person on with the camera. There's just you with me, so you
Okay.
probably see me.
I do see you, and I see both of us actually. So when they do the recording, they'll see both of us. But I know that I can actually do this and turn off the camera and everything like that, and then you see me in my nice suit and everything like that. But definitely share with us what you've got on your mind today. We'll see if Kim joins us or not. I know she's working on something else as well. But yeah, you're front and center right now.
Okay. Well, Um, I mean, you can ask me the questions, but what we're going to talk about today are Medicare's two girlfriends, and the Medicare two girlfriends are known as Maggie and Irma. And whenever you get on Medicare, Maggie is the one that controls how much money you bring in. So whatever the amount of money is, that's Maggie, which is modified adjusted gross income. And Irma is when you have to pay extra.
Hmm.
So that's what we're talking about. Someone who was on her husband's insurance, and her husband had a nice job. And she decided that she was going to get on Medicare because she didn't want to have to pay the premium that they're paying for her benefits. But he was still working. And so because he's still working, she got off his company insurance and she ended up enrolling in Medicare, and she thought her premium was going to be zero. And that's what the agent told her, where her Medicare Advantage plan is what she enrolled in. Because whenever it's time for you to get on Medicare, and Kim just joined us, and when Kim gets on Medicare, you just start getting bombarded by so much of what's going on.
I got my book.
Everybody and their brother, yeah, that's what you're showing me. Everybody
I
and
don't
their
know if you
brother.
noticed. So this is what Medicare sends. This is what the company, not the other insurance companies that sell you supplements. Medicare itself, they sent me this with my card, and they said, "But continue on." But yeah, absolutely, it's confusing. So keep going.
Well, this person, her husband had a nice job, and he was 63. He's under 65, so he's not getting on Medicare, but he's working with employer benefits. So, what I can tell people is when you have employer benefits, the best thing to do is to go to your HR for that company and talk to them and find out what you need to do to get on Medicare. And she was surprised that whenever it came time for the premiums to be taken out, that she ended up having a $732 premium deducted from her Social Security check. Well, that's not her Medicare. That's the premium for her Part B and her Part D that comes out of her Social Security check. So she did not need to enroll in Medicare yet because her husband's still working and she has employer benefits. She could have waited until he had retired. And the big mistake that she made is she went ahead and she disenrolled herself, or he disenrolled her from the employer benefits, but she enrolled in a Medicare Advantage plan because she thinks her premium is going to be zero. She didn't realize additional money would be coming out of her Social Security check. So she was shocked when her Social Security check was $732 less. And she didn't need to enroll at all. So because she enrolled in the Advantage plan and she disenrolled herself from her husband's insurance, she has to wait until fall to re-enroll back into his insurance and to disenroll her Part B of Medicare because she has employer benefits. It's going to be 7 years before her husband retires. He's not retiring until 70. So what people need to realize is when it's time for you to get on Medicare and you start being bombarded by all these phone calls, don't answer them. Don't talk to somebody, because all you are right now is a walking dollar sign.
Speaking of the walking dollar sign and all along those lines, I'm actually get on camera for this part and all along those
Where
lines.
are you? We don't see. There you are.
Yeah,
So,
on camera and
so
everything
let
there
me.
for a second. But I did have a question because really quickly, I want to hear from you as well, Kim. But I know that in this research that you sent me and everything like that, the person was shocked because this is a lot of money. That's almost close to $1,000, 732.50 that was deducted from their Social Security check. And a lot of people are going to depend on their Social Security checks as they get to a certain age and everything like that. So they even told you that they were shocked because of the amount that was deducted. Now, was this the amount deducted just as a one-time deduction, or was it deducted
Every month.
every
Every
month?
month.
Every month. You've
Wow.
always got
So
to
let
pay
me.
something every month. If you are not working full time with employer benefits, her husband had employer benefits, so she could have waited until he was 70 to enroll in Medicare Part A and Part B. But she could have had Part A is at no cost, but she could have waited until he was 70 because she was on his employer benefits. And that's where it's confusing. And I know in here, you've got two girlfriends with Medicare. You got Maggie, which is modified adjusted gross income. That's the amount of money that they're basing your premium on. And you got Irma, income related monthly adjusted amount. So Kim's getting on Medicare in July, August, somewhere.
Well, October
October.
is my birthday. And I did manage to speak with someone who does this. She's going through a lot of stuff right now, but she does sell the supplemental insurances and things like that. But she's a consultant. She helped my sister in law. And my sister in law, we were all having lunch, whatever. But anyway, and so I don't like to engage friends in business. So, it was more like just curiosity, asking questions. But to respond to your question or your concern about how expensive it can get, I got my book, right? The other thing, yes, they harass the mess out of me. I'm going to go to the commissioner here in North Carolina and I'm going to say, we're going to stop this because I literally get bombarded every day. My mailbox on my phone, my text voicemail gets full in an hour because so many people have my name from wherever they're getting it and they are just bombarding me. I've attended 2 full classes on this and another, well, I don't really consider it a class on this. It was investments and stuff like that. But Medicare is the biggest scam I've ever seen. I mean, point blank, I look at this and the laws need to change because it should be as easy as I retire and Miss Calhoun, you and your husband both paid in all of these years And here's an insurance policy for you to have that covers everything from A to Z in medical care. Everything you need. It doesn't matter. You don't have to sit there and roll the dice and pray you picked the right plan and then you didn't because it doesn't cover your treatments. Um, One plan covers everything and it's $200 a month, period, and everybody pays it unless you're way below income, whatever. It should be that simple. It's not.
It's
It
not.
is that simple in other countries because Nick has a very simple plan in Spain. I've seen very simple plans in Albania and in Greece and in France. So it is very simple in other countries, but not here. So here's the book you get when you start
The
to
book doesn't
qualify.
tell you.
It is from Medicare. It is from SS whatever
They
gov.
just started releasing that book. Uh, it gives you the basics.
Yep.
But you've got
So
to be able to personalize your Medicare. That's not the same as
oh yeah, I mean this is pretty thick, right? And it's the topology look on things, and it tells you if this is what you think you are, do a deeper dive. But it doesn't give you the deeper dive.
now.
It just says you need to do more research. But to give you an example of, it does tell you if you ordered the wrong plan and then you have to wait to get it again, you're going to pay a penalty for getting the wrong plan. If you didn't get the drug plan because when you picked this, but later you decide you need the drug plan, then you're going to pay a penalty. And it explains, it does the breakdown and
Yeah.
explains the penalties. So
It-
if
it-
you want, I can send you a copy of the book.
Definitely want
But
to
I
do that.
think
Just
because
really
I
quickly
think
along those same lines,
we've
Tony,
got a
just
lot of
really quickly
confusion
because I know
going
you had this
on.
example of Brenda from Myrtle Beach and everything like that, but I was wondering, is it impactful where you live? So, like, is somebody going to have? Are the plans universal? Like, if you live in California, where our co-host Rick Rosner on some of our shows lives,
yeah,
or
Cal
somewhere?
has different.
Well, here's
It's
my
different,
book, which is the Medicare Survival Guide. And
right? And that's
how I got started. Okay, just give me 5 seconds, 5 minutes. How I got started was a gentleman called Social Security, and they gave him the wrong information about Medicare,
yeah.
and it cost him over $10,000. People do not realize there's three family members to Medicare. There is Medicare, there's Social Security, and there's the IRS. But Medicare does not enroll you in Medicare. Social
So
Security enrolls you in Medicare. The only thing Medicare will do is guide you as to what prescription drug plan is going to best meet your needs and give you the rules. If you're someone that has a health issue, then you need to talk to your doctor and find out which way is the best way to go. People need to realize, I mean, the rules as far as getting a Medicare supplement are different statewide.
Yeah,
In
that's what
Texas, and I think also in North Carolina and Florida, when you first get Part B, you have a 6-month window that you can get any Medicare supplement without having to answer one health question. And that's important because if you have a health issue and you've got cancer or whatever, and you decide to go on an Advantage plan, and now you can't go see your doctor and you want to disenroll and get into a Medicare supplement, if you wait too long, you'll have to answer health questions and not qualify.
Wow.
So
right,
that's where the confusion comes in.
and pay penalties. They even
If
put
you don't
in here
enroll
that,
at the right time, you'll
right, you'll
say,
pay
well,
penalties.
I don't need a Medicare Part D. I don't need Medicare Part B because I'm not going to go to the doctor.
Gotcha.
And so they don't want to pay that extra $202.90 a month that the average person is going to pay for Part B. They don't want to pay it. But if they decide they need it at a later date, let's say you wait 5 years, then your penalty is going to be 50% because it's 10% for
10%.
every year you
Yeah.
could have had Part B, but you failed to enroll. And
I
then
know it shouldn't be that way, because you shouldn't be asked to roll the dice to determine whether you're going to need something or not. It just should be overall, but we're not going to go there because that's not how it works, right?
Can
This
we
book,
change the rules? Like what, I mean, I know we could go and lobby to,
we
I mean, I've
can,
talked to my congressman,
but we
but
can, but this is what, so I'm on Social Security because when my husband died, I elected to get his Social Security. Okay. And I did all the math to determine yay or nay. I didn't do it right away, but when you're on Social Security, they do like you said, they do automatically enroll you.
they know
Okay,
that you're turned 65, so you'll
right?
automatically get your Medicare card with
Exactly.
Part A and Part B.
So so they sent me a card with Part A and Part B on it and a book. And they said that by October, I'm automatically enrolled in Part A and Part B unless I send them a thing saying, no, I don't want that. I want something else. So that's where I think one, it gets very confusing because immediately everybody thinks, well, then I'm just covered because they might not read the book or read it right. The book they send us should kind of reflect your book. Your book is probably an easier deep dive instruction of why. Their book is more of, okay, if you're currently on Medicaid or if you're currently on
Medicare.
a
Yeah.
insurance or something, then this. But but their then this is more like call call Medicare.gov.
Yeah. Well,
So
and
but
just
they
really
have
quickly,
A and B, but this is where it gets confusing, Mark, and it can be very expensive. They have Medigap. Okay, that's where you would get supplements like Tony was telling us about, which
right.
are very important if you have health problems like I do. But where it gets very confusing is what used to be A, B, C, and D. You get your drugs. Is they have all the way K through N.
Well, that's your Medicare supplement.
I, again, why is it so complicated? Why do I have to sit there and go, am I going to have chicken pox next year or 5 years from now, or am I
Are you
not?
going to have cancer? What happens if you get
Right,
leukemia? Or what
right.
happens? But you got to realize that is a minor book. In the fall, by October 1st, they send you your Medicare and You handbook. But the only problem is that book does not tell you what's going to happen as of January 1st.
Right.
You
So,
know, they can't, they're printing the books right now and they don't even know what the Part D premium. So you got A and B, which is original Medicare,
Mhm.
and Medicare got started July 30th, 1965, when LBJ flew to Independence, Missouri. The cost was $40 once a year. The cost for everything coming out for it was $40. The premium that you paid for Part B was $3. Nothing
Oh,
was based off of income. Now it's based off of income, and you're considered single, but you're still working. So if you're on Medicare and you're still working, and as a single person, if your income is over 109,000, or as a couple is over 218, then that's when Medicare's two girlfriends kick in that affected Brenda out of North Carolina. And the two girlfriends are Maggie, modified adjusted gross income, and Irma, income related monthly adjusted amount.
yeah, that makes
I
sense.
like how
Anything
we
like that. Hey, just really quickly, Tony, you kind of alluded to it earlier in this discussion, but um, what should people, and I think even Kim might be dealing with this, and I don't want to get into her personal business, but I have talked about it and he doesn't hide it. But if somebody has a um, long term terminal illness, because my brother has MS, we don't hide it and everything like that, what should he do in terms of like his things around Medicare? Now, he's younger than me, so he won't have to deal with this for about 8 years because he's going to be turning 57 this year
That's a
and
good
everything like
question.
that. But I just wanted your thoughts around people that are dealing with, because MS
People
is
that are
a
dealing
terminal
with a
illness.
serious illness, when you get on Medicare and you get Part A and Part B, it's best to get a Medicare supplement because you can go to any hospital and doctor nationwide. So if something happens and you're in North Carolina and you develop cancer and you want to come to MD Anderson, that's one of the top cancer centers, or you've got to go to the Mayo Clinic that's in, I think it's in Minnesota, or you want to go to a doctor that's in California that specializes in your health issue, you pick up the phone and call. As long as they're accepting Medicare, you just go. But people need to realize that there's about 60 billion people, there's scams that are happening every year. I mean, the phone calls are blowing up left and right. And
well, these are scams that the government can put an end to if they wanted to. They could put an end to it, because we don't need, what we need is a payment plan that goes into what I call socialism care, if you want to call it that, I don't care. But it just goes into a system and the doctors get paid. There's no more insurance that's needed. I think we just need to get rid of that part. We don't.
Well, it sounds like a good idea, but it takes them about 5 years to ever make a change.
It's not easy. I mean, we've been working on change, and we're now in the lobby mode. We're not paying lobbyists, but we're changing the law right now that has been scamming people for quite some time. And it's been 3 years since I met them, and I said we need to go to DC and change the laws, and now they are doing that, and it's great. And the change is gonna, it's making progress. It's getting a lot of attention, gaining traction, but it's not easy. A lot of people give up at a certain point. So, but again, unfortunately, we don't have laws to do that. So the key is to find out how to fit the puzzle, basically, to accommodate each person's needs. And immediately people are going to go, well, I don't need this and I don't need that because I'm not sick. I don't
know how things are going to be 5 years
right
from now. And people
right
need to realize what their situation is. If I can help a gentleman who put Neil Armstrong on the moon, he worked at NASA here in the Houston area, and he was a rocket scientist, and he was retiring, and he couldn't understand what he needed to do to get on Medicare. You don't have to be the smartest person in the world to do this. You want to take the time and personalize your Medicare, because what one of my sayings is with Medicare, what you don't know will hurt you, not today, but the rest of your Medicare life.
Your life. Yeah, and I'm gonna kind of make a little bit of a statement here, and it's not to insult anyone, but I believe the smarter a person is, the more complicated this is. And the reason is that very educated people, smart people, engineers especially, it's hard for us to understand why would someone make something so complicated, right? Well, engineers especially, and I've worked with astronauts. They see things piecing together like a puzzle. Why this doesn't. This is a bunch of pieces that don't really fit together, and the math doesn't add up. And then that's really your science people. I can see them having a meltdown looking at this, because I do, and I look at it. Social Security wasn't this complicated. My God, I just told them, my husband died, and I'm entitled to survivorship, and them. And, they asked me, they said they did do are you sure? Do you want to get it now because you can make more money if you wait? And another one said, why don't you do the math first? So I did the math, and I said, I'm sure. So done. But it's like you said, you can pick the wrong way, the wrong direction, and then 5 years from now need something else, and you're going to pay more. Yeah.
Well, one thing that people need to realize is, let's say they don't have the book that you have. What they need to do is go online to Medicare.gov and they just put the name of the book in their Medicare account, and you can download that book. That
Yeah,
book
I mean,
just that book was not around last year. That's a brand new book.
Yeah, it's a brand new book. Speaking of books and everything like that, I just wanted to, because usually I'd have the banner, but since we're recording it on Zoom this time, I just wanted to give the number. So if people are interested in getting this wonderful information from Toni, they can call 832-519-8664. She will gladly help you. And all along those lines, the email is info@Toni, that's with an I, not with a Y, TONI says.com. So it's www.tonisays.com. So if you'll go there, you'll be able to be in touch with Toni, and she can give you all of this information. And of course, we do this show weekly and all along those lines, but definitely just wanted to have that opportunity to let Toni know that we were going to give her a plug for her places and how she can be reached. And you can
Well,
even see the website on the behind her, tonisays.com.
but one thing that people need to realize is Medicare is income based. So if you're, it's based off of your income, and Medicare does not enroll you in Medicare. Social Security enrolls you in Medicare, but the one that controls everything is the IRS. They know exactly how much money you made, and they will base it off of what you made 2 years ago, not what you're making
what
today.
you're paying now. Yep.
Yeah. And
And then that's,
if your income has come down, there's forms you can file to let them know so you can make your Part B premium less. So when
yeah, I
you're
mean, the IRS has played a bigger role, but I remember having to fill out the IRS forms for my parents so that they could get whatever it was benefit that they needed. Because, and I'm like, but they don't even make any money right now. Um, there's, it's a simple form. Fine, fill out the simple form, send it in. So, a lot of people think, well, I don't need to do a tax return because I'm not going to file, I'm not going to pay because I don't make any money. That's not how they work. And
no,
a lot of your, a lot of your care benefits that for low income people, you have to earn something. I think it's like $11,000 in order to even qualify for some of the benefits. So it's a complicated system, Toni, and I'm so glad that you've got a book, not just a book, but a show where we hope to get more viewers and people will start coming in and asking questions because this is a gut wrenching
but
stories. It's
and
some
it's
gut wrenching
personalized.
stories.
You've got to realize that it's personalized. And when you first get on Medicare, or when I mean, even if you're 60 years old, I don't know how they get our phone number, how they get our email,
They
but
buy it.
I mean, the state sells it to somebody, and
Yep.
somebody, yeah, they know exactly. They start calling
Oh,
or emailing you a year prior to you turning 65. Don't answer
don't do it.
the phone. A friend of mine had her dad was a vice president for Coca-Cola here in the Houston area. I mean, the man knew, he had been around the block a few times, but supposedly his grandson called him and told him he was in jail and needed help. And that's what Mr. Houston thought, that the grandson was in jail. So he had wired money, and it was all a scam. So you got
Yeah,
to be
we see
careful.
that cyber imposter scam a lot in the cyber industry. And though I kind of want to retire from a lot of doing that, occasionally I get caught up into helping people. But um, it's a big scam. They are trying to get into all of the rest homes, assisted living homes, to tell people, hey, you know,
Hey, Kim, just
these
real
are the
quickly,
scams to look out for.
I know this is Medicare moments and all along these lines, and I agree Toni is doing a wonderful job, just like Irene
Thank
is
you,
with the
Tony.
timeshare industry and everything like that. But one of the other shows that we have, and I think we have an entire network or a channel on it that deals with the scams. And Tony, you might be even wanting to get on that show. Is Rexley, no relation to me,
Cyber scam.
has cybersecurity and tech storms because he is a cybersecurity expert. So he has like a whole. There are 4 channels on Pod TV, and one of those channels is dedicated to the whole notion of what we can do to fight against the whole cyber scam industry and everything like that.
We could do a whole show about just
Scams.
Medicare scams, not scams where the people are cheating Medicare, but the other way around, where the people are selling themselves as an agent and overselling products that people don't need. And I think that I don't comprehend how the government has allowed this to happen. That's what I think is disturbing. And
I think a lot of it has to do with the insurance companies and how they,
of
I mean,
course,
they own Congress. It's all
yeah,
about
that's right.
it's all about. But people need to realize if you don't know who the person is that is calling you or emailing you, don't send them anything.
Oh, I
had a
got
friend of mine,
mails. I got
yeah,
letters. Happy birthday. We're here to help you. Happy birthday. And my birthday's in October, but they're sending, here's your birthday gift. We're going to give you free counseling on your Medicare. I've got cards that say that. I've been throwing them away, but I'll
it's
keep
not
one for
free
your
because
show.
they want to
I
try to sell you
know.
something. But I had a client who I got an email from him saying he's got a health issue. And I'm like, wait a minute. How did he, that wasn't him. It was a scam email. He got scammed. And they've
Yeah.
been sending out emails saying that he had been scammed. So people need to realize, I mean, the girl, Brenda, her husband was still working. She should not have gone and enrolled in an Advantage plan. Now she's got to wait until the fall and re-enroll back into her husband's insurance, but she thought it was only going to cost her, it was going to be zero. She never knew the money was going to come out of her Social Security check.
Yeah,
that's
where they get all their money back is they bill directly to Social Security.
Yeah.
So that's
Quickly,
to me another scam in itself.
and everything like that. But Tony, just really quickly, how many of these letters? Because I know you have your newsletter and you have other ways that people reach you. So tell folks how they can reach you. I did mention
We
Tony.
have the newsletter,
How
and
many
I've got.
letters do you have?
I gotta go, but thank you so much, and I look forward to next week's show. We'll get the tech fixed. So,
How many do you average a week and everything like that in terms of like the amount of letters that you get?
I can't. I mean, I get a lot of letters, a lot of emails asking for help. Totally.
Wow.
So I think she's trying to get on.
I got it.
Yeah, she got it. She knows how to exit.
Computer issues. I'm telling you, it's terrible.
Yeah.
How many there right now? There is 60 billion people. Excuse me, 60 million people that are being scammed on Medicare, and they say that there's been over probably 700 million that have been scammed since Medicare got started.
Wow.
So you got to really be careful. I mean, the scams are coming left and right. Somehow my sister, somehow somebody got her Medicare number and she had over $9,000 in urinary catheter that was charged. And I said this a couple of weeks ago so that people would know about the scam. But she's never had a bladder infection or a kidney infection or anything. So how that happened, I have no idea. So they need to realize there's 3 family members to Medicare: the IRS, Social Security, and Medicare. That's the only government agencies that are involved. But you got 2 girlfriends. The modified adjusted gross income, that's Maggie.
Right.
You got your Irma. So when you turn 65 next year, we're going to look at the 2 girlfriends and see how Maggie and Irma is going to affect you. It depends on, are you single? Are you married? Are you still working? What's your situation?
I plan to still be working next year just because I enjoy the cultural work that I do. I mean, health issues could change that, but if I have my druthers, I'll still be working at 65 and everything like that. Don't know right now. I'm one of those perpetual single people. I've never been married, but who knows? Maybe I'll find this right and that could change next year. But right now, I
You
think that
never
I
know.
will be in the single space and everything like that. But right now, I've been single forever, so I might still be single next year. But then again, Miss Right or might come in to my life and that might change the next year. But I know a friend of mine actually is getting, and he's gonna have to deal with this because he's not that much younger than me. I want to say that Dasan is hitting near his 50s, so I know he's younger than my brother and everything like that. But he is getting married in October, and I actually
Well,
ran
that's
into
good. That's but see, now his income will go up. But
right,
that's, I mean, we can get it all confused, but that's what I want to talk about. Medicare's two girlfriends that are Maggie, modified adjusted gross income, and Irma, income related monthly adjusted amount.
yeah, and his
That's
income will
very
definitely.
important to know how much money you got coming in. Now, if you're not working anymore, there's ways you can appeal it, and people can go on my website. I've got the Medicare First Steps, it's a guide, and we've got the Medicare Roadmap that's got videos and everything to it to help you.
And they will
Okay.
have a nice blended income. I know we're wrapping up and everything like that because I know that he is a poet and performer, but he is also a professor, and all along those lines. And his wife or wife to be, his fiance, is actually a consultant. She's actually a consultant now with attorneys and everything like that. So she's actually doing some work about making sure that attorneys understand business and all along those lines. So she's a business consultant and a leadership consultant for attorneys and everything because she's done leadership consultants for others as well. And then she's also been involved in sports and the other things as well. But yeah, Desan and Jess will be jumping that room very shortly. I think it's October is just around the corner and everything like that. So yeah, they
Well,
should be
we can,
jumping.
if someone's got a company or you have an association and you want a Medicare workshop for that association without talking about different insurance companies, mine is a generic, and it can help you and give you that information, give that company that information. You've got to do the right thing.
Yeah.
So, all righty,
All right.
we
Well,
can
on
do
that note,
this
I'll
again
hit the.
next week.
Yep, I'll see you next week. I'll hit the pause recording right here, and then I'll do the commercials after I splice this together and we put it on the network and everything like this. But this has been a fun conversation. Hopefully, we'll get StreamYard back up and running next week. But if not, we can do it this way as well. But right now, we're going to end this. This has been another amazing conversation with the amazing Tony King. But we're going to get off and end this right now. So I'll see y'all next week, and who knows, maybe